Someone just had the nerve to ask me, what do I use to dye my hair? I am a natural blonde.
What is an ovarian cystectomy and why might it be recommended? Most ovarian cysts are benign. That means that they're not cancerous. In fact, functional cysts are common and they often go away on their own. But a dermoid cyst is another type of benign cyst that can actually grow teeth and hair despite it being placed on the ovary. So an ovarian cystectomy is a surgical procedure that is done to remove a cyst from the ovary without removing the ovary itself. It's often offered to you if a cyst is causing you symptoms like pain, bloating or pressure, or if it's a particularly large cyst, if it's persistent, or if it looks unusual on a scan. Sometimes surgery is the safest or the most effective option, especially if your cyst is large, that's bigger than 5 centimetres, if it's causing you significant symptoms, if it hasn't gone away and we've given it a few menstrual cycles, if it's found in someone who's postmenopausal, we're maybe more likely to recommend removal, or if it does have any suspicious features, so we think it could be problematic. Also, large, heavy cysts, like dermoid cysts, can actually weigh the ovary down and cause it to twist on itself, something called ovarian torsion, which can threaten the blood supply to the ovary, and that's risky. So those are all reasons why we may not leave the cyst inside and we may recommend removal. So if a cyst is large, if it's heavy, or if it's concerning, we may recommend removal. The aim of the surgery is to remove just the cyst and preserve as much healthy ovarian tissue as possible. That's especially important if you are hoping to get pregnant in the future. So, can an ovarian cyst be removed without removing the ovary? Well, yes, that's the goal of an ovarian cystectomy. Unless your cyst has completely taken over the whole ovary, or if there's another reason the ovary can't be saved, like for example if it bleeds heavily during the surgery and that bleeding can't be stopped. Otherwise, surgeons would aim to remove just the cyst and leave the ovary intact, and that helps preserve your hormonal function and your fertility.